So when you see someone at the Eat to Live Institute and they're coming in standard American diet, a lot of different symptoms, diagnoses, et cetera, and their goal is to get off all their meds, more or less, that's not a cold turkey thing. Like, what is your thought process? How do you go about that challenge?
The most problem is diabetic medications and blood pressure medications, because people most times were cutting back. And like we had a type 1 guy who comes in, for example, on 6 units of insulin a day. He's a type 1, so he needs insulin. And he has an insulin pump. And he was in medical school. He had to quit medical school because of his diabetes was going high and low. He couldn't concentrate. Like have doctors all the time losing their profession, and other doctors quitting their emergency room job because they're so sick, right? But anyway, he does so well, and I cut his insulin back gradually. He's doing so well in this program that his pump, but he only requires 11 units of insulin a day as a type 1. And now doing such great shape, he's back studying again, going back to school again, and back proceeding with his career. And he's only requiring 11 units of insulin a day. Mostly with blood pressure, they're usually, people on 2 or 3 medications. I usually, at the very first day they're there, I'm going to probably lower something like a diuretic, because I don't want them to get too low. And then, of course, I'm checking their blood pressure when they first arrive. If it's high, they're coming in really high, I might leave them on it for a day or two and keep checking it. But the minute it starts to get the normal range, I'm very alert to quickly start lowering, because you'd be surprised how fast this works. So the health professional taking care of people on medications has to be very alert and in constant contact with these people, so that they make sure they're, especially the first couple of weeks, to make sure they can appropriately lower medication fast enough, because the overdose of medication can really hurt people. It reminds me, I was just on the phone, I have somebody texting me their blood sugar every single day who's at the retreat as a type 2 diabetic. Every day they're giving me their numbers, and I'm cutting them back every day while I'm here, for example. You know what I mean? On a daily basis. In that study we did on over 450 people with high blood pressure, what we found from that study was that there was the doctors treating these people put them at risk, because they did not lower their medications and remove them quick enough, and they put too many people at risk with low blood pressure, which can then cause lack of perfusion of the kidney, increased risk of arrhythmia in the heart, causing somebody to faint and smack their head on a sidewalk and get a concussion or something, fall down and hurt themselves. So there's so the problem is that the conventional doctor caring for people switching to a Nutritarian diet is not going to be alerted to know how careful you have to watch these people to cut back their medications appropriately. So once we get one reading below 120, I got to cut back. Or once one blood sugar comes below 120, cut that back, start cutting back. Don't let the person get too low. Err on the side of letting it run too high. You know what I mean? So it's better to let your blood sugar run 120 to 150 when you're taking the type 2 diabetic, because the next day, if the first day they're at 100, you think it looks good, but they're still on medication, and then a day later they can be too low. So be cautious and be cautious and careful, making sure you appropriately and carefully remove medication, because too much medication can be very damaging when they don't need them, right? Mm-hmm. You guys heard that part of the lecture when I talked about blood pressure medication, dropping diastole too low, prevent blood from getting back to the heart again. We don't want to over-medicate when low blood pressure is not dangerous if you're not on medication. You want your blood pressure to be low. It's not going to hurt you, because because the body's setting the blood pressure. You don't need much pressure to get it back to the heart, because there's not much resistance to flow. The body is very smooth, and my blood pressure can be 90 over 60 because I'm not on medication. That's okay. But I can't be on medication pushing it to 90 over 60. That could be dangerous for a person, medicating them to that lower level, because they don't have as smooth and elastic vessels with no resistance to flow as I do, for example.